Can you provide a definition of intensive care medicine?
Intensive care medicine is the hospital GP.
Well, intensive care medicine is the care of the sickest patients in the hospital, where we can provide organ support that is not available anywhere else in the hospital.
For me, it is the most holistic form of management of a sick patient. It is internal medicine, it's observational medicine, it's interactive medicine, it's responsive to the patient's needs. The patient is at the centre of everything.
The definition of intensive care medicine, I think it's most exciting field in medicine because it's really, we are on the border all the time, a border of knowledge, of development.
The definition is to treat patients with at least 2 organ failures.
Exciting, saving lives, supporting life.
Acute, quick, with pleasure, with very ill people, teamwork.
Take care of the most severe patients.
Intensive care medicine is hard to define. It is actually all which is in relation to patients who are really in trouble. So it could be monitoring, it could be treatment. It doesn't mean that patients are between life and death.
Definition of intensive care medicine, I think it's any patient that needs special attention with regard to monitoring and support for end organ function.
Not exactly as the doctors can do, but for me, intensive care medicine is a very nice specialty where people are very involved in their job. It's the reason why I'm working for the SRLF.
In your opinion, in what area did the practice of intensive care medicine change most during the past 10 years?
Likely the way we ventilate the patient.
This lung protective ventilation strategy completely transformed the care and reduced mortality.
In my mind, no question, the practice of treatment of septic shock, the diagnosis and treatment of septic shock has changed dramatically in the last 10 years.
I think in all sorts of areas. I think recognition of the importance of sepsis in terms of early diagnosis, early use of antibiotics, the sepsis guidelines, in terms of ventilation and ensuring that we get ventilation correct and don't damage the lungs. Similarly with fluids and vasoactive agents, making sure we don't do harm. We always thought the more we did, the better it was. Now we realise that a little bit of something is better than a lot of something.
I have 2 comments on this question. First, it is the admission of old patients. I think 20 years ago we did not admit many old patients like now, and for the practice it is, I think, non-invasive mechanical ventilation would change the ICU.
Ethical.
Following guidelines?
In what area will the practice of intensive care medicine change most during the forthcoming 10 years?
We will be entering in electronic era, so with full of informatics and electronic, no more papers in the ICU.
So I think we're going to have to redefine the way we look after old people and the way we triage them.
Identifying which patients have a particular need for a specific therapy, that better definition of molecular phenotypes in patients with sepsis and other critical illnesses may lead to more specific therapies.
We will have more and more intensive care patients, and probably the hospital will become a very acute hospital, so we'll see a big increase for the work of the intensivist in the future.
We need to develop new forms of therapies.
Probably in identifying underlying conditions, mainly gene polymorphism, to explain vulnerability of patients to sepsis and poisonings too.
What is your most striking souvenir in the ICU?
Well, I think what one remembers is patients who were really critically ill and have survived and made a good outcome. I think those are the kind of memories that you don't forget.
I had many memories. I can't think of a specific one at the moment.
Some deaths that we felt could have been prevented. It has been rare, but sometimes we lose patients and we think perhaps we could have done something different. So it's rare, but it remains in your head.